Any other questions? We covered a lot today, but any other questions that anybody has right off? Kayla? All right, we're gonna stop in 6 minutes for sure because we're over.
Well, it's fine. One of them was kind of already answered briefly. Like one of them was I struggle a lot with the terminology. Like some of the words I can understand, like the cardi and the hyper, those things.
Okay, what
It's
does
just
cardi
like when
mean?
it's heart,
Okay, and hypo means?
low,
Hyper means?
high.
It doesn't sound like you're struggling.
Well, like when it comes to, combining them with things like with, what's the naming for decrease in heart rate? It's like it takes me a while, and so I can't like get it right off the bat. And then when it comes to like questions like, okay, so you're getting these signs and symptoms. So what would it be? Is it bradycardia, tachycardia? Is it dyspnea? Yeah. So it's just kind of those um things that I get tripped up
Okay, so
on.
let's go over this quickly. So when it comes to words, when it comes to naming conventions for words, right? You have the main word itself, so that's going to be called the root word. Okay.
Hmm.
Now all words have to have a root. Okay.
Yes.
They may or may not have a prefix or suffix. The word in the front, that's going to be our prefix, and the word in the back, that's going to be our suffix. Okay. So some common prefixes. All right. So one of them you mentioned, that's going to be Brady. Brady means,
Don't tell me I know it.
look at the screen.
Slow,
Okay. So what's the word for fast?
tacky,
Tacky. Okay. What's the word for normal? You. We talked about euthyroid today. That's a normal thyroid. Okay.
gotcha.
Euvolemia is normal volume. Hypovolemia. Oh, so hypo is low.
Hmm.
Hyper is high or excessive. Okay. Dis means difficult. Okay.
Hmm.
Let's go over like suffixes. Let's say algia means
Pain.
pain. Okay. Like fibromyalgia or dentalgia, so dental pain. Okay. Now, and there, okay, itis,
Inflammation.
inflammation, or some kind of swelling, swelling of. Okay. Ology, study of. Okay. So let's say we have pathology, that's study of disease. Physiology, study of the function. Okay. Let's say we talked about an ectomy. That's a removal of. So,
Hmm.
like if we're a surgical removal of, we said a hemithyroidectomy or partial or a total thyroidectomy. That's an ectomy. Okay. What about a osis? That's an abnormal condition of. Okay. Pulmonary fibrosis, anthracosis, sarcoidosis, pneumoconiosis, bacilliosis, right? The osis, those are abnormal conditions of. Okay. Those are just common ones to know. Now, let's go over root words. Okay. Cardi is what?
Heart.
Heart. Let's go hepato. What's that? Okay. Hepatitis is inflammation of the, what's that?
Liver.
Liver. Okay.
Okay.
Let's go spleno. What's that?
Your spleen.
Spleen. Okay. Now let's do another suffix like megaly. If somebody has splenomegaly, what's that? That's an
Mm.
enlargement of the spleen. splenomegaly, hepatomegaly. If they have hepatomegaly, what's that?
Enlargement of the liver.
Enlargement of the liver. Okay, that could come from Crohn's disease. I meant to say cirrhosis. It could come from cirrhosis. It could come from alcoholic liver, fatty liver, things like that. Okay. Oh, what if they have? This is a good one. Emia. So emia is something in the blood. So if they have, hyperkalemia, that's elevated what in the blood? Elevated potassium. What if they have hyperglycemia? What's that? Elevated what in the blood?
Sugars.
Sugar. What if they have hypoglycemia?
It's low blood
That's
sugar.
low blood sugar. Okay. What if they have hyponatremia? That's going to be
Sodium.
low sodium. Okay. So when it comes to lab values, we have the K is for potassium. The Na is for sodium. The glyce is for blood sugar. Okay. Okay. Let's say somebody has, cyto, no, not cyto. Let's just say penia. If somebody has some kind of penia, that's where they have a low amount of.
Hmm.
So if they have thrombocyto, so cyto means cell. Thrombo means platelet. So if they have thrombocytopenia, that means they have a low platelet count.
Hmm.
However, if they have thrombocytosis, that means they have a high platelet count. If they have neutropenia, that means they have a low amount of neutrophils, which are a type of white blood cell.
Mm-hmm.
Okay. So these are very common ones to know. And for this, what I would recommend is just flashcards and just kind of repeat them over and over and over. Or if you'll go back, like you could literally just Google or go to Chat GPT or Claude or whatever AI tool you use and ask for 100 of the most common medical terms.
Okay.
Top 100 medical terms. Okay. And then ask for, what you want to know is these words are made up of prefixes, root words, and suffixes. And then the way we join these things together is typically with like the letter O, and that's going to be what's called a combining form. Okay. So O is kind of the letter that's in the middle of how we take this word and stick it together. We typically put an O in the middle. Not
Okay.
always, but that's the most common combining form. All right, so I'm over now on time. But this is something I'm glad you asked this though, because even though it's very basic, it's something that trips up a lot of paramedics also because they just simply don't know the word. And so much of medicine comes down to just knowing the vocabulary. But when you know the vocabulary well, everything is so much easier. Okay. Like tension typically is some kind of pressure.
Mm-hmm.
So, like blood pressure. So, if we have hypotension, that's low blood pressure. Hypertension, high blood pressure. Okay. But just think about how many things we came up with today. So, just from this, we talked about tachycardia, bradycardia, hypotension, hypertension. We talked about vasoconstriction, vasodilation. Let's put those in. So we have, That would be more of a suffix. Constriction, dilation.
Mm-hmm.
Constriction means to get smaller or to
Mm-hmm.
squeeze.
Yes.
Dilation is to get bigger or to relax. Okay, we have vaso, we have veno. Vaso typically comes with arterioles. Veno is for veins. All right, and
Yeah.
just think about how many words. Like a lot of this came up just today.
Yeah.
And what you notice is I'm just using these terms, but I've been using these terms for 20 something, like 25 years. So this is just like my second language. It's going to be the same for you. The more you use these terms, the easier it becomes. Okay, this is just like I just speak the language of medicine, and
Right.
the more you use it, though, or the more you hear it, the better it's going to come. It's going to become just second nature. All right, right
Yeah.
now you're just kind of in the beginning of you're kind of early in the game, but once you've been in the game for a while, you'll just rattle off these terms. Okay.
Okay. That's good.
But definitely go back over this. This is a great list to have. If you want, you can just take a screenshot of that.
Definitely.
You got it?
Not yet.
Okay. Tell me when.
I got it.
You got it. Okay. Now, any other questions? Because we're over on time.